So if you're only missing one tooth, why a dental implant over a traditional bridge?
Well, it's a good question because bridges have been around forever. Most of the time they work fairly well, but there's definitely problems that we have with bridges because now instead of just having one problem where you're missing a tooth, we've got to involve the teeth on either side of it and connect those teeth in this bridge process. So now down the road, if there's ever an issue with one of these teeth, it's not just one tooth you're dealing with. Now it's 3 teeth because you can't handle just that issue since everything's connected. So it adds maintenance issues, it adds complexity to future potential problems down the road. Whereas if we just put an implant in, if we gave you the tooth back that was just removed and do that in a way where we don't have to involve the other teeth, it just makes that much more sense. We can deal with this problem, not create other problems, and it's one that with implants now, hey, they work. They're very
What about cost? I mean, what costs more, the bridge or the implant in the long run?
So initially, they're roughly about the same. In the long run, the implant is far less expensive. The maintenance, the potential problems down the road, you know, if you're looking at it from a cost-effective standpoint, an implant is definitely the better choice.
Is that the future of dentistry? That means whether it's 20 years or 100 years, bridges will be gone.
Yeah.
You miss a tooth, you get an implant.
You know, and one of the things that allows that to be such a strong statement is, in my process, we use a CT scan to look at the area, and then on the computer, I do implant surgery on your problem on my computer and develop a guide that places the implant in exactly the right position. We don't have to guess anymore. We don't have to worry about, it's a little bit, you know, angled too far, or maybe things didn't come out the way that we wanted to, but because they didn't have the ability to use a CT scan and to use this computer-guided surgery, they're dealing with problems. Where this approach, it takes all those issues out of the question.
So somebody in your family, if they were just missing one tooth and they were of the age where they could do this, would you always do a single tooth implant over a bridge?
Yes, and I'll take that one step further. In my own mouth, I'm doing some dentistry and having some things done with some orthodontics, but I am going to have 2 implants placed myself.
Okay, but you're not going to do them yourself.
Well, it'd be a little tricky, but yeah.
What about pain though? It seems very painful. Is that something they complain about?
You would think that it would be. I can't tell you how many times when we speak with our patients the next day that, yeah, I took a couple Advil, but things feel great. I mean, actually placing the implant is far less uncomfortable than removing the tooth.
Okay. How old can you be to get dental implants?
I think the oldest one I've done it on was 88. So
it doesn't matter. The
age doesn't
matter. They're not more likely to fall out if you're 88 years old. No?
Absolutely not. Absolutely not. It's all based upon just physiology. You know, if the implant can work in a 20-year-old, there's no reason why it can't work in someone who's 70. So age is not an issue. Amount of bone and quality of bone sometimes is, but age has nothing to do with it.